Make fun of my toes. No, nobody's gonna make fun of your toes.
Say cheese.
Okay.
Alright, come on.
Can you grab a sandbag?
Yeah. You want a little one like this or a long one?
that one.
Just a little. Thank you.
Okay, so typically everyone uses sandbags on lower extremities because the patient's leg wants to push it out, and so that'll hold it still. Now, when you do a patient in real life, you're going to have them laying down, but she wants to see so she can sit up. But it's much easier when they're laying down. All right, pick a toe. Number?
Two.
Number 2. Okay, so we're going to take that 2 and put it right in the center because we need from here to here, right? So it's in the center of the cassette now. Tube angle. We've got to get in those joints, so it's just 10 to 15. And then we're going to put our CR on the toe. Leave room for a marker. Shield her. And if she's sitting up, which she wouldn't be, she's laying down, just throw it on top of her. Doesn't have to be wrapped around or anything. If you want to do a little bit more collimation, you can, but then what happens? You start losing your marker, right? So you got to leave room for a marker in there. So you're pretty much getting all of the toes. Beep. Immediately take your angle off. And now you need an oblique. Which way are we going to go? Medial. Ooh, sorry. Medial. Other way. Medial. Patient. That way. Beep.
That's not bad.
Now what? We need a lateral, and what projection is it going to be? Lateral medial, right? So she's going to roll all the way in uncomfortably. And I forgot to bring a tongue depressor, but if I had a tongue depressor, you would take this toe if they're not in too much pain.
Oh, wow.
Just like the book.
Just to isolate it?
Mm-hmm. If it hurts too bad and they think it's broken, just take a lateral of it the way it is. You're not really going to see anything, but if there's a fracture, you might see its anterior posterior displacement. Beep.
Now, if you're doing the lateral for the toe, does her ankle normally have to be flat down?
I'm just looking at the toe itself.
Oh, yeah,
I saw when she went down, it kind of over-rotated.
All right.
So there's going to be
you just have to
OID.
make sure as long as your
Toenail is lateral.
Okay.
Yeah. Now, a lot of people's toes are going to be wrong, and it's not going to happen, but get it as lateral as you can.
Okay.
All right.
Oh, now see now. Oh, sorry.
All right, now we need a foot.
I can't wait to practice it.
For the foot.
I'm gonna bring my hand sanitizer. Oh man.
Tube angle is 10 for a foot. I'm just going to go right in the center of the foot.
What's that?
Beep. Mm-hmm. Beep. And now which oblique is it? Angle off. If you want to go, because naturally it seems like you want to do that, but no, it's this one. And don't say medial lateral, because then you're insinuating that it's a lateral. It's a medial what? Oblique. Yeah. Beep. Now we got to do the lateral foot, and now we are going to go medial lateral. So I'm going to get with her foot. Now if she turns, turn all the way in your hip, like on your side. See how most patients are going to do that when they're laying down? You see how that plantar surface, how it's obliqued right there? So what you have to make sure you do is just pull their knee up until that's perpendicular, and just say hold it right there. Yep, if you want to use the pillow, takes longer, but beep. Okay, so it's an AP, medial oblique, medial lateral. Now I've got an ankle. So we're going to put their legs straight out. Put the malleoli right in the center of the cassette. Right in the center of the cassette, and you're going to bring this down to the ankle. Some collimation. Beep. Now what do we have? More teeth, which is how much? 15 to 20. So we're just going to look. That's hardly any rotation right there, but that's 15 to 20. Beep. Now what? the oblique. So now we've got to go 45. So you've got to make sure you don't want this. What's that called? Inversion. It's going to invert a little bit because she's trying to stress and hold it up there. But a lot of times the patella will show you 45 degrees. Beep. And this is going to show, what's this? That's important. That distal tib fib that's fibrous. That's going to show that one. Okay, now you're going to roll up on your right hip. You're going to do lateral. Okay, that's where she wants her ankle, so we're going to set it right there. Bring this to her ankle. And beep. It's just knowing your views and getting the light on the part you're looking at. As long as you know your views, you can figure it all out, because there's an ankle. Just put it in those 4 positions, put the light on it, you're good.
Remembering the angles.
No specials for the ankle. So now I just have a tib fib. Oh, calcaneus, thank you. Forgot about that one. All right, foot right on there. We're going to use the long axis. This has a big tube angle, 40 degrees. So I'm coming all the way over there. So.
Yeah.
You're going to put this right at the foot crack, the base of the 3rd metatarsal.